Nova Scotia, a province with soil as rich as its history, a land built around fishing and farming, a beautiful province with a strong reputation for wholesome food and outstanding hospitality. It's a great place to live. But despite this wealth of food resources, Nova Scotia is the most food insecure province in Canada. All across the province, in both rural and urban communities, there are people who live in food deserts, areas where access to affordable, healthy food is a huge challenge.
Hello, my name is Athanasius Soloboy. I'm a Mi'kmaq nurse practitioner here in the Millbrook Health Centre in the community of Millbrook. Something like food deserts and food insecurity is something that affects a lot of communities across Canada. So we know that it does directly impact a lot of Indigenous communities. Even here in Nova Scotia, a lot of our Mi'kmaq communities are certainly impacted by access to affordable food.
My name is Denise Van Wyschen. I live in Brookvale, Nova Scotia, outside of Middle Muscatawbet. Well, right now we have no grocery store here, so we have a couple of convenience options and a market, but the access to full-time, all of the groceries you would need, we don't have access to that within 20 kilometers of my home.
My name is Mary Desmond, and I live in a rural, isolated community. It's an African Nova Scotia community in Upper Big Tragedy. Food desert is people needing food but can't access it at an affordable price. Right here where we live in Upper Big Tragedy, there's food available, but we can't access it, and it's not affordable for us.
My name is Kathy Spearing, and I live in Dean Settlement, and I live in a food desert. So for folks in my community, it's upwards to an hour. Either New Glasgow or Truro or Elmsdale would be the closest areas to buy groceries. And like I say, it's about a 45-minute to an hour drive, depending on where you're going to go to get your groceries.
Our cultural food is not available either for us, and that is a big thing for us in the African Nova Scotia community.
Not everyone lives around the corner from a supermarket. Big grocery stores tend to position their stores in suburban areas where there's lots of parking, which is fine if you have a vehicle.
So there's lots of people carpooling and sharing rides or picking things up for other people. Very common to see on Facebook, I'm going to town Tuesday, does anybody need anything?
The grocery store is in Bridgewater. There is Bob and the Boys in the summer, but again, that's about an hour and a half walk. And it's all downhill one way, which means uphill on the way back. And then the gas station's even further, and it has much less and more expensive too. Everything's kind of a just keep your fingers crossed and hope. And when I do get to the store, if I take a taxi, it's $40, so it's $20 there and $20 back. And right now I only have $60 at all. So that means I'm spending more money on gas than I am food. Mm-hmm. So if I can get a ride, I can get a bit more food. If I can't, then if I get milk, we're lucky.
We have no public transportation here, so even if there was a store that was close enough to get to, there's no way for most people to get there if they don't have their own vehicle. We do have a community transportation rider, but it has a cost to it.
My name's Ashley Swan, and I started coming to Maggie's Place 18 years ago when I had my son. Really, people don't have transportation in Truro. We don't have any kind of public system of transportation. There's a lot of people that don't have vehicles.
I'm Shannon Mulford, and I live in Eastern Passage. Well, the first and probably the greatest challenge would be the fact that I've chosen not to have a vehicle. But there are times, especially in the winter, in the really inclement weather, that it is definitely a challenge, especially going uphill coming home with groceries. Not all of the roadways have sidewalks, and it can be a little bit dangerous at times depending on who's driving where.
My name is Linda Weston, and I live in Bridgewater, Nova Scotia, and I will be 74 in just a couple of weeks. This is the other problem I have, is that I don't drive. I have always, wherever I've lived, I've always been able to either walk or bike, well used in the hill. And I've spoken to one of the counselors. It's just like, can the bus not come up here? It's about, I can do it in about 10-15 minutes downhill. Takes about a half an hour uphill, depending on how much I'm carrying.
Getting there is part of the problem. But what if there are no grocery stores to travel to?
We did have a grocery store, a co-op in Middle Musquodoboit, and it closed several years ago. So the people in the community have sort of the convenience stores to try to pick that up.
We used to have a grocery store, a local co-op, but it's been closed for a number of years now. The impact of closing, I think, on the community has been tremendous. For those who live here and don't travel or have access to travel, it's meant a big deal to them. They have no easy way to get their groceries, especially affordably.
If you're like me, you probably remember having a grocery store in your neighbourhood. It wasn't a big store, but it served the neighbourhood very well. And it was probably independently owned and operated. And for rural communities, independent grocers play an important role. They help ensure food access in areas that big chain grocery stores refuse to service.
We owe a lot to independent grocers in Canada because they've brought a lot of innovation to the food retailing space over the years. But unfortunately for them, it's becoming more difficult to compete against the larger outfits like Loblaw, Sobeys, Walmart, and Costco. They've done these four companies have done very well nationally, and as a result, we've seen more independent grocers close.
Is there anything that the provincial government could do to help small independent grocers become more sustainable? For example, could they better survive if they were permitted to sell wine and beer?
Once you liberate the alcohol market, it really gives a chance for independent grocers to generate more income otherwise. In fact, it is in the province of Quebec where you see the largest market share for independent grocers than anywhere else, just because of the fact that the alcohol market is much more privatized. But at the end of the day, we also have to think, especially in Nova Scotia, we have to think of ways to create more jobs in rural communities, especially in light of COVID, where more and more people will be working from their homes.
But it isn't just rural communities that are impacted by the closure of grocery stores. And it isn't just independent grocery stores that close and leave communities deserted. When the margins aren't there, the big grocery chains close shop and move somewhere else, often leaving communities without easy access to food. In 2009, the Woodside area of Dartmouth lost its neighbourhood Sobeys grocery store. This closure and the controversial way it was done ensured that the community would remain a food desert for at least 20 years.
That's probably the highest density neighborhood in my constituency. So you have a couple of high-rise apartment buildings and a number of low-rise apartment buildings. A lot of folks who don't have access to a vehicle. And so, for those folks with no vehicle, and even if they have a bus pass or access to public transportation, the bus routes don't work to get you to a grocery store with any kind of expediency.
Hi, I'm Kate Langan, and I live in Woodside in Dartmouth. We used to have a Sobeys in this area just down the bottom of the hill, which was really great. But when they closed, our lifestyle had to change quite a bit.
My name is Mary McDougall. I live in Woodside, and it's currently a food desert. Yeah, I mean, I miss it terribly. I'm still fairly bitter over the fact that they closed, and I try not to shop at Sobeys if possible. I did used to walk there every couple of days to get our groceries. My daughter was young at the time. It was a family, grocery store.
I'm Paul Lynch. I'm a member of Southdale North Woodside residential area. Been living here for 23 years and I love it here. Had a huge impact. It was one of the best Sobeys around. People could get together and talk. It was like a real community area where people can gather.
When we heard that Sobeys was going to close, I was very disappointed, because it was a small store and it was a community store, and we knew that everybody who went there. We knew all the people who worked there. They all lived in the neighborhood, and we felt as though it was like sort of a part of our community was being torn out.
First off, we had to travel 2 kilometers to get to the next Sobeys, which was the closest one in Penhorn Mall. And back at that time, we had 4 kids, no cars, so we had to lug our strollers and our kids to get to our groceries. And not a lot of the time we had money for a taxi.
When Sobeys left that store and built another one a few kilometers away near Penhorn Mall, they had a covenant on the deed of sale, which stated that no purchaser could sell food or medicine in that location. But when I heard this, it just struck me as fundamentally inappropriate.
Things like that, sort of like moratorium, that just should not be allowed.
It made me very angry. As soon as I found out about that, I thought to myself, how is this legal?
I wrote to head office and said, this isn't the Sobeys way. The Sobeys way, historically speaking, has always been to support community, and this is not supporting community. Didn't get an answer, but...
We also contacted Sobeys and asked the company to comment and participate in this documentary. Unfortunately, they declined. As a result of the restrictive covenant, Provincial MLA Claudia Chender introduced a bill that would eliminate the use of covenants that obstruct the access to the sale of food or medicines. Unfortunately, an election was called before Ms. Chender's bill could get passed into law. But she hasn't given up.
And so I think what we were trying to point to with this piece of legislation was, this is not something that ought to be able to be restricted by law. There is no good reason why you shouldn't be able to sell food anywhere. So we certainly will reintroduce it and put it back on the order paper, and we will hope that it gets passed, and we will continue to push for that. But in the meantime, we also hope that this business practice is discontinued, essentially.
Sometimes we don't necessarily appreciate how some people are heavily impacted by closures. Yeah. And so I think in some way you kind of have to think about, the implication, because you're basically just killing a network, and not just a grocery store. You're killing a network of people gravitating around a food source.
Food deserts are more likely to exist because big grocery stores are not attracted to lower income areas. And while vehicle ownership and access to public transit are factors, there's no denying that poverty, plays a huge role in the creation of food deserts and food insecurity.
I think most people assume that people have enough food to eat. I think if you're not experiencing food insecurity, it's very difficult, if that's not touching your own life, to put yourself in the place where you can imagine that for someone else.
My name is Jen Organ, and I work at the Ecology Action Center here in Halifax. There's not an equal playing field, so not everyone has access to the same resources as other people. An example would be as simple as, low-income neighborhoods don't have the same access to food as other neighborhoods potentially, or even rural communities.
Nova Scotia is the highest province in Canada for food insecurity. We are a rich country. There's lots of food. But it's the distribution that's the problem. And I get so passionate. But to see people and our children in Guysborough is over 17% of our children in Guysborough are hungry.
Employment, ability to work, income levels, people living in poverty, people who are, trying to make ends meet. They're really hard situations when you're trying to buy food.
Mi'kmaq communities are certainly impacted by access to affordable food. Poverty is a big thing in our communities. There are a few grocery stores people go to. But for certain people, definitely transportation to those areas can be a barrier.
And I ask people, how do you get to the grocery store or to your doctor's appointment with no transportation available? They hire a car. Which costs them about $50 to get up to Antigonish. Now, if you're on a low income, that's a lot of money to go up and get your groceries. So they only were going uptown once a month. So if you're going uptown once a month, how can you afford to buy fresh produce, fresh fruit to last you once a month?
So I'm David Mitchell. I'm mayor of the town of Bridgewater. We have lots of access to food in Bridgewater. There's grocery stores almost on every kind of section of the town. But that doesn't mean that everyone can get proper nutritious food, whether it's because they're making that decision on, do I pay my power bill or do I get food? Do I pay my mortgage or my rent or buy food? It's easy to forget that just because there's food in the community, it doesn't mean that everyone has access to it. And then the other issue, of course, is there's access to food and there's access to nutritious food.
Access to nutritious food. Not just any food, nutritious food. So how does the lack of access to nutritious food impact personal health? And in a province where healthcare is a big issue, how do food deserts impact the health of a community?
So I'm Nancy Ryan, and I'm a clinical dietitian at Nova Scotia Health. I work in the Dartmouth area, and I work in nutrition education. And so what we know about the social determinants of health, and food insecurity is one of those social determinants of health, is that has a bigger impact on our collective health and our individual health than individual diet and lifestyle choices. So it's really important for healthcare providers to have an understanding of that, because when people come to see us and to see me for, say, advice about diabetes or about hypertension, if they don't have access to healthy foods and the foods that are recommended to manage those conditions, then there's an immediate barrier, and often it's insurmountable.
When kids should be learning in school, they're having to worry about where is my next meal coming from, or I didn't have dinner today. So unfortunately, this is something that's still occurring in a lot of communities, not just Indigenous.
My name is Father Ron Cairns. I'm the chaplain here at St. Kateri Tadagawitha Church in Indian Brook, also known as Sebeganegati. There's probably about 15 convenience stores on the reserve. And probably like almost all convenience stores, there's lots of pop and chips and cigarettes. And today, cannabis. But there's not much what I would call food. And certainly no healthy food.
And so food deserts, they tend to have more convenience type stores that have more highly processed and convenience foods that are higher in fat, sugar, and salt. And so it's not that we can't eat these foods. They can certainly be included in a well-balanced, enjoyable diet. But when they contain the bulk of your diet, then harmful effects can happen.
So I'm just outside a convenience store, one of the few stores in the Woodside Pleasant Street area since Sobeys left this area 12 years ago. So if I were living in this area, don't have a vehicle, or it's difficult for me to get to the nearest grocery store, which is a 15-20 minute bus ride away, or perhaps a half hour, 45 minute walk probably. This is what I would have to do if I was urgently in need of some food for my dinner tonight. All right, so let's see what happens. So Nancy, I had $30 to spend. I didn't have enough time to take the bus way to the grocery store, or do that 45-minute walk to the nearest grocery store. So anyway, here's what I got. The kids needed fed tonight, and I honestly tried to get fairly nutritious food, pretty nutritious. So I don't know if I got the basic milk. Is that okay? Are we okay with that?
Yes, of course. Yeah, Ian, I'm thinking you actually did quite well with, a very limited choice here. I'm seeing some good sources of protein. I mean, we've got milk and eggs, and there are some legumes over here. I think these are canned beans. So in the protein department, you've got some options here, and I think you definitely made some good decisions there with what you had available. Bread, you chose whole wheat bread, so of course that's part of a healthy, balanced diet. Yeah, and so then I guess the main thing we're thinking about is, how do these convenience foods, how do they fit into a healthy diet, and how do we make them a healthy meal?
Sure, yeah.
And so certainly they can fit. I think what I see here is really lacking is the lack of fruits and vegetables, right? There's nothing fresh. And so if we think about Canada's food guide and the recommendations through those guidelines, they suggest that half of our plate should be fruits and vegetables. So there's really nothing there. And we know that of the 50 vitamins and minerals that we need every day, a lot of them come from fruits and vegetables. So we're really missing that. So that, I think, is kind of a key concern.
Right, yeah. There is strawberry in the Pop-Tarts, though. Does that count for anything?
I usually don't consider the jam, so it would basically be a jam. I probably wouldn't consider it a serving of fruit. Tastes delicious, but probably not a whole serving.
And I did get some vegetable soup.
Right.
Now, surely that's worth something.
Yeah, so same kind of thing. I wouldn't completely discount it, but I don't think it's going to kind of meet that the guidelines or the recommendations around the amount of fruits and vegetables we should be trying to get. The other thing I really notice in this selection of food, and probably one of the most concerning things, is the sodium content of these foods. So canned foods and processed foods, they really have incredible amounts of sodium, and it's really hidden in there. So it's not like we're adding the salt to these meals. We really don't have a choice about it being there or not.
So at this point, you may be thinking, why do people live in food deserts? Why don't they just move somewhere else?
So I lost my job, my car, and my house. And I was living in a women's shelter. And I made a phone call just out of desperation to someone selling land, and he just happened to have, a cabin in the woods. And I said, hey, what's the worst that can happen? And I took him up on it, and so far he's probably been the most angel on my shoulder.
A lot of people have asked me about my choice to live in Eastern Passage. The biggest reason that I live here is because it's close to my grandchildren, and to me this was moving into the city.
We all deserve to live where we want to live. And, you know, in spite of the challenges of the winter weather, you know, up on Lemon Hill or whatever it may be, it's beautiful. And some families have been there for many, many, many years, and that's where they have chosen to stay. And I think that it's unfair to penalize people for wanting to live a rural lifestyle.
Overcoming the challenges of a food desert for me is actually capitalizing on some of the strengths that I still do have and that I want to retain, such as staying active. I'm a senior.
Nowadays we have to put trailers on the bikes and get waterproof bags on the bikes because the nearest store is 3 kilometers away. We work hard to maintain this lifestyle choice that we have made to ride everywhere we can and do everything we can by bike. There's sort of a bit of a pride involved in doing it again, you know, getting the groceries home again. Maybe they taste better because we've, you know, burned the energy that it took to get them here.
I've got chickens and roosters. They're walking around the property and they give me eggs and company. They're also quite entertaining to watch. And then I'm starting a rabbit breeding program. So I'm actually breeding meat rabbits, and that would be my source of protein for the winter. So I've got my protein, I've got my eggs, and eventually I'm going to get into permaculture and start growing my own vegetables, but there's no soil here. So everything has to be built up. This is my haven. I know it doesn't look like everybody else's $1 million dream, but this is my $1 million dream right here.
Some individuals have their own solutions for overcoming the challenges of living in a food desert, while others take their solutions one step further into the wider community.
I'm the coordinator of a project called the Barefoot Farmers Association. We're a not-for-profit organization. I created this out of my own desire to look at food insecurity and figure out a way to help people without having the power to bring in a grocery store. So we will go to your home and we will look at the land and see what could grow there and provide free seeds and tools and instruction on how that would work. There's no obligation to the organization. You can keep all the food for your family, or we will come back and buy some of that food back from you, which then will get donated to one of the local food pantries or food banks. Or we have deliveries where we do along Musqueam Valley, Eastern Shore, and Colchester County on Fridays.
I appreciate it. Thank you very much.
This is Alyssa. I wanted to introduce you to her. She's our summer volunteer with us every year. Alyssa's been a 3-year volunteer with us.
Excellent.
So she's also a little farmer. She grows her own food. And
Okay.
Donates all the pumpkins that she grows to our little elementary.
It's just about sharing food. And that's what we're trying to do. It's just a little piece of trying to address the food insecurity.
I had an old filing cabinet and I was tearing down my office. The old filing cabinet was going to go to the landfill. So I decided to reuse, recycle. So I got a friend who was an artist and she painted it. And I put it down at the foot of the lane. And I got a little grant, and we put food in it. And that helped people to go down there and get food. I don't do anything down there now for the food pantry. The community has owned it and took it over. Like, you know, I said they put solar lights up to help people see what food's in there in the evening. Because people go there at nighttime and, you know, they're getting their needs met, and as little as that little food pantry down there, Thousands of dollars went into that food pantry, and I thank the government for the funding that they did give us. I really do. I appreciate that. But that's not the solution. That's not the solution. To me, it's just a Band-Aid.
It's not just individuals like Mary or Kathy that are bringing their solutions to their local communities. Community organisations such as Maggie's Place in Truro work to create food projects that help families become more self-sufficient and wiser around their food needs.
So Second Harvest Food Rescue was just a program out of Ontario, and it's just an app on your phone, and local businesses sign up and they post what they have available, and as an organization we rescue it and then we distribute it to other families and other people in the community so that it doesn't go to waste.
Yeah, so locally here in Middle Muscatava, we have this project called the Thoughtful Food Project. And it started a number of years ago, and it's a bunch of different organizations got together and decided we needed to work on food projects, and this gave us our little bit of a title for it. So we've done communal meals up at the high school where we have volunteers go in and help the students learn how to make a meal, and then they prepare the meal for the entire school, and they get to eat that for free. We've created a couple of gardens. So we have one at the elementary school that we work in combination with the schools and the community to grow produce there. And last year we produced over 1,000 pounds of produce out of that garden.
There's food boxing programs that are coming up, and apparently there's like a food bus in the works too it's going to go from community to community, bringing food to our Mi'kmaq communities. So there's certainly good aspects, certainly trying to address food insecurity.
Well, I mean, I think there are lots of creative solutions that have sprung up. There's a Common Roots Urban Farm, which is a nonprofit that started in Halifax but has a satellite location actually in Woodside.
So we're here at the Common Roots Urban Farm in Dartmouth, and it's right on the site of the Nova Scotia Hospital. And this is an amazing place where community members can purchase a plot, or I guess rent a plot, and grow their own food. So it's a great example of how communities come together in resourcefulness to overcome the lack of access to healthy foods in food deserts.
We have a community garden in Bridgewater that's been in place for, I think it's at least a decade now, so that's been a huge success.
So, many people are striving to eat nutritious, locally grown food. And it seems to me that the ultimate goal should be that we all have dignified access to healthy, nutritious food at reasonable prices that's mostly locally grown. That would mean a greater degree of food autonomy for the province.
I think we need something other than just big box stores and the big grocery chains. We shouldn't be dependent upon two national chains for our food and for our food supply, especially in this area, there are so many farmers and there's so much produce, so much local food that can go from field to table quickly and easily.
You want rural communities, rural economies to become more vibrant, and there are a few ways to do it. But the one way that is very effective is to support your agri-food chain from farm to fork. And so we are seeing this movement becoming more present in Canada, people wanting more local foods. And I know in Nova Scotia it's the same thing. What's unfortunate for Nova Scotians is that we're not seeing as much movement to produce more food all year round, because in Nova Scotia, what we've noticed in our research is that Nova Scotians want to buy local. They're even willing to pay more for local, but they're not hardwired to look for local foods all the time. If you're pushing people to think locally all year round, then it becomes much easier for anyone to actually get people to look for local foods. And unfortunately, compared to other provinces, Nova Scotia is a little bit behind in supporting a really comprehensive food autonomy strategy for the province?
Largely, I think what would need to happen is more investments and resources in our local food economy, so supporting our farmers. I think also supporting better distribution systems, so food hubs are being talked about a lot around, as a way for different mid-sized farms to kind of come together and a place that helps coordinate the distribution of those foods and out to other communities.
I really think that there's an opportunity, especially in the Musquodoboit Valley, for us to be growing more of our own food for ourselves, and that would take a lot more money for infrastructure and could create a lot more of employment. I think there's an opportunity there, particularly for the government to step in and to make more support for the growing of our own food for our own residents, to kind of not have to have the food come from so far away.
We have the land and we have the climate and the soil. What we need are the people with the skills and the desire to do what is really probably one of the most difficult jobs you can have, is to work the land.
Nova Scotia is a great place to live, work and play. But we need to find sustainable solutions to our food desert problem.
There's probably not one solution to a food desert.
I think the solutions being they all should be community driven.
Because everything's kind of linked, we don't have anything where we're just targeting food security. But as we deal with energy poverty, or we deal with the housing crisis, which is from coast to coast to coast in the country, all of those will directly impact the issue of food security.
Ultimately, this is a much bigger and much more systemic issue. So we know that wages have stagnated. I think we need a higher minimum wage so that people can afford groceries.
Yes, I started that little pantry down there, but like I said, the community took it over.
There's a gentleman, the late Chief Charlie Labrador. He's a very Mi'kmaq visionary. And there's a saying that he said, if you walked into a forest and you looked around and you would see a pine, a birch, a sugar maple, red maple, all different trees are sparsely populating the forest. They're all here for each other. They're all together. And if you look under the dirt, their roots are all holding hands. We as people should do the same.
That's everybody's responsibility. It's not just one person's responsibility, it's everybody's responsibility. Nobody should go hungry today. Nobody.
I would like to take you out of here, but the city's concrete crush should break your tiny bones. Riding on the bus would leave you feeling even more alone. And I don't know how hard you try. All I see is a clear blue sky, while you're halfway up a mountain side, holding on for life, holding on for life. I could put myself where you are, to slow things down. But living large is really hard to give it all back. I'd